Hello, and thank you for joining today's webinar. We are ready to begin. Today's webinar is eligible for 1 contact hour. Sigma Theta Tau International Honor Society of Nursing is an accredited provider of continuing nursing education by the American Nurses Credentialing Center's Commission on Accreditation. The speakers and planning committee members have disclosed no conflicts of interest. To receive contact hours for this CNE session, participants are required to attend the webcast and complete the evaluation form, which will be emailed to all attendees following the webcast. Certificates will then be emailed to the attendees. The webinar is being recorded and will be available via the Sigma repository within 10 business days of recording. Following the presentation, we will have time for question and answer. You'll see on your GoToWebinar control panel that you can send a message through the questions feature. This is where you can type in any question you'd like to pose to the presenters. Be sure to hit send so that the message makes it to us. Now I'll turn our presentation over to Dr. Liz Madigan to introduce our presenters.
Hello, I am Dr. Liz Madigan. I'm the Chief Executive Officer of Sigma Theta Tau International Honor Society of Nursing. We are delighted to present this first webinar in a series of 3 focused on nursing, health, and climate. As a nursing leadership organization, Sigma promotes advocacy on issues affecting health, and that is what you will learn from these webinars, how to effectively advocate for change on this critically important topic. One needs only read the news to see what's happening in the world and the need for leadership by nurses to promote world health. On behalf of Sigma Theta Tau International, we would like to thank the Alliance of Nurses for Healthy Environments for today's collaborative webinar offerings. We would also like to thank our speakers for sharing their expertise with us this afternoon. With us today is Barbara Statler. Dr. Statler is a professor in public health at the University of San Francisco and a nursing leader in the area of environmental health, including issues related to climate change. She has been an advisor to the EPA's Office of Child Health Protection and the National Library of Medicine for informational needs of health professionals on environmental health. Dr. Statler was a founding member of the Alliance of Nurses for Healthy Environments. Under her leadership, ANHE has played an important role in the fight against fracking by alerting policymakers and the public to the detrimental health impacts of the chemicals used in fracking on the communities nearby. Our second speaker is Fiona Armstrong. Her expertise lies in policy, politics, advocacy, and communications, particularly in relation to climate change and health. She is the founder and executive director of the Australian Coalition of Health Groups, the Climate and Health Alliance, and the architect of the framework for a national strategy on climate, health, and well-being for Australia. Fiona is the recipient of the prestigious Tony McMichael Ecology and Environment Award from the Public Health Association of Australia. She is also a co-founder and director of ClimeArt, Arts for a Safe Climate, an independent, not-for-profit organization that harnesses the creative power of the arts to inform, engage, and inspire action on climate change. Our final speaker is Katie Huffing. She is a certified nurse midwife and is the executive director of the Alliance of Nurses for Healthy Environments. Ms. Huffing works with nurses and a national nursing inclusion of environmental health into nursing education and sustainable healthcare. She has written numerous peer-reviewed articles on environmental health issues and was an editor of the environmental health e-textbook, Environmental Health in Nursing, which won the 2017 AJN Book of the Year in Environmental Health. She works with nurses and national policy organizations on a variety of environmental health issues, including climate change, chemical policy, and inclusion of environmental health in nursing education. We are so excited to have you all with us today. Now let's get started with today's presentations. Thank you.
This is Barbara Statler, and greetings from both the Alliance of Nurses for Healthy Environments and from California, which is where I live. Next slide, please. I'm going to be going over a very simple explanation of climate change. And to start with, I'd like to say that we've been sort of in a global homeostasis for thousands and thousands of years. The sun has been beating down on the earth. It's warmed our oceans and our lands to a certain extent, but also some of that heat then has reflected out and it's gone out beyond the atmosphere. And that regulation of both getting heated and being able to release the heat has kept us at temperatures and at a climate that has allowed plants and animals to flourish. Next, please. But now what we have is we have a situation where we have greenhouse gases that are collecting and blanketing the earth. And they are preventing the heat that would otherwise be going out and past our atmosphere. They're preventing it from leaving. And so we are accumulating much more of the heat than we ever had before. Very similar to having a blanket around the earth right now. And you might ask where these greenhouse gases come from. Well, you can see the balloons there, which indicate that they're coming from a range of things, including coming from our energy sources, that's the largest one, but also our industries that include healthcare and transportation, agriculture, waste, forestry, and from our buildings. Next, please. We originally called it global warming because, in fact, that's what this blanketing effect has done. But that became confusing to some people when there would be winter storms and they would say, well, how could it be warming? We're still having winter storms. And so really what we're looking at right now are climactic changes, where things are occurring on longer term changes in terms of our weather, not just day to day. Next. So most of you have heard that this is contributing to the melting of ice packs, the melting of glaciers, and this is already becoming part of coastal flooding in many areas, which is predicted to become far worse. On the top left, there's a picture of the southeast quadrant of the United States, but you can also see the high-risk cities around the world that have huge populations that will be at risk. And they are at sea level, and as the sea rises, they will be in real trouble. Next. The other thing that is of great concern with regard to climatic changes is that we are going to be seeing changes in crop production. Some of that is from extended droughts and flooding, and some of that is because we are changing the general heat level on Earth, and some crops are not going to withstand that hotter temperature. And as a result, we're going to be seeing more malnutrition and more famine around the globe. Next, please. You also are aware that we're seeing excessive heat in places. And this means for many of our most vulnerable populations, those who are working in agriculture, our farm workers, those who work in construction and in utilities, those people who are homeless, but also vulnerable populations who may have difficulty in escaping the heat where they live. In the summer of 2003 in Europe, which has very elegant infrastructure to address heat issues, they had in excess of 70,000 deaths that were attributed to heat. Next, please. We also know that in the global south, that they've already been experiencing sometimes extreme and really prolonged periods of drought, which has created massive problems with famines. And all of you, I'm sure, have been tracking what's been going on in Australia over the last several months. The devastating fires there. We in California have been experiencing them too. This combination of heat and fires, floods, and droughts are predicted only to get worse. Next, please. These heartbreaking fires that we've been seeing are predicted to be hotter than they have been before and coming in more frequency. And we've been seeing just larger and larger swaths of land that are affected. And one of the things that is associated with this also is that in many parts of the world, people have moved into the forests. So our suburbs have moved further into the forests. And so we have more population at risk to what were these natural occurrences in our forests before, but are now becoming public health threats as well. Next. Attributed to climate change are really many changes in air pollution. Some of this comes directly from our reliance on fossil fuels, both the extraction sites, the refineries, and then finally the utilization of fossil fuels in transportation, heating, and industry. We are also seeing changes in allergens that has quite a bit to do with the changes in the flora associated with climate change. And then, of course, asthma, which is something that is directly related to air pollution and to the allergens. We're seeing increased risks there. Next. Another change that we're seeing globally is in some places we're seeing longer and wetter seasons that are contributing to increased populations of vectors. So in some places it's ticks and Lyme and their associated Lyme disease risk. We're seeing malaria and dengue in places where we never had those risks. And the same with hantavirus, whose vector is rats and mice. Next. We know that every year nearly 2 million people die of malaria currently, and that is going to only increase as climate change moves forward in its current trajectory. Next. Something that you might not have thought of is that we're seeing increased risks for waterborne diseases and foodborne illnesses. Some of this is associated with algae blooms and other kinds of disequilibrium that's happening in our rivers and in our oceans. And this can contribute to diseases that are foodborne, or it will stop us from being able to fish and or crab in those areas. Next. We're also seeing specific diseases, including an exacerbation of existing chronic diseases, cardiovascular diseases and respiratory diseases, but then also increased risk for some of our not just vector-borne diseases, but infectious diseases that will be associated. And once again, our most vulnerable populations are going to be the ones that are going to have comorbidities associated with all of these. Next. The extreme weather events are the ones that create the most immediate devastation in areas, and those have been hurricanes and tornadoes and increased monsoon activities, and also shifting of where geographically these patterns occur in areas that have not been prepared previously for them. Next. I'd like us to think about how costly these are, not just for human lives, and that's really obviously important to us, but also these extreme weather events take down our infrastructure for water and wastewater, for transportation, energy, and communication, to the tune of billions of dollars a year that are now going to have to be redirected because of these extreme storms. The budgets that all of our nations have are generally static. So this funding is going to have to come out of health budgets, school budgets, social services, and so forth. So something for us to be paying attention to for sure. Next. We are already seeing climate refugees. This is expected to continue within countries, across borders, and also as island cultures flood, those whole island cultures are going to be moving to the nearest inland areas. Next. We know that we can address this in a number of ways. Obviously, nurses can be involved in resilience strategies, not just in our healthcare delivery settings, though that is a really important part of this, but also working in the communities that we work with. Creating disaster plans is a part of our climate smart strategies. We need to be working, and our other speakers are going to be talking about how we can work on mitigation, but we need to currently also be working on our preparation. Next, please. I just want to reiterate that our most vulnerable populations in our most vulnerable countries and regions, children, elderly, those who are disabled, cognitively impaired, people with existing health and mental health issues, and our migrants and refugees, these folks are already vulnerable, and they are the least resistant and resilient, and they are going to be the ones that we have to really make our health plans for. Next, please. There are a great many organizations that are involved in this. I'm sorry I don't have Sigma's logo on here. I do have the ICN's logo here. And I think working together, working more strategically, this is going to allow us as nurses to share our resources, share how we plan and respond, as well as how we support mitigation. Next, please. And with that, I thank you. I look forward to hearing the other speakers and being available to answer questions at the end. So thank you so very much.
Thank you, Barbara, and thanks to the participants for joining and to the organisers for bringing this together. I'm Fiona Armstrong from the Climate and Health Alliance in Australia. Next slide, please. What I intend to cover in this presentation is to talk about some of the global policy frameworks guiding action on climate change, namely the Paris Agreement and the Sustainable Development Goals. I'll then talk about some of the work that the health sector has done in Australia to develop a national policy framework to guide governments, the health sector, and the community in taking action on climate change. Next slide, please. We've heard from Barbara about the health impacts of climate change, but questions for nurses and other health professionals are, what are the policy instruments that are being developed to tackle this? How are they being implemented? And are they enough? So there's growing recognition in international governance about the links between climate change and the human right to health. This is recognised in the text of the United Nations Framework Convention on Climate Change, as well as in the Paris Agreement. The United Nations Framework Convention on Climate Change, the UNFCCC, is an international treaty that obliges parties to that agreement. So that means members and member nations that have signed and agreed to that convention. And they have agreed to stabilise greenhouse gas concentrations in the atmosphere at a level that would prevent dangerous interference with the climate system. The Paris Agreement obliges parties to that agreement to consider their citizens' right to health in their climate change response and to recognise the health co-benefits of choices that are made in relation to mitigation action. However, if there is no national policy framework that includes consideration of the health impacts of climate change or the health implications of climate policy decisions, nations will fail in their obligations under this international agreement in relation to human health. So in the Paris Agreement, all parties are to develop and act on what are called nationally determined commitments, or NDCs. These are the commitments of each individual nation on what they will do as part of implementing the Paris Agreement. At present, the collective impact of all nations' nationally determined commitments under the Paris Agreement will see emissions continue to rise and global average temperatures reach 3 degrees or more. So there's much to do to turn this around. I encourage all nursing organisations to be calling for action at the global level for the UNFCCC to be prioritising health in programs and initiatives that are developed as part of implementing the Paris Agreement, and to advocate in each of your respective nations for each nation to increase its level of ambition and its commitments under the nationally determined commitments. Next slide, please. So the Sustainable Development Goals are a collection of 17 goals that are designed to be a blueprint to achieve a better and more sustainable future for all. So the SDGs, which were established in 2015 by the United Nations General Assembly, are intended to be achieved by the year 2030. These SDGs were adopted by all United Nations member states in 2015 as a universal call to action to end poverty, protect the planet, and ensure that all people enjoy peace and prosperity by 2030. So of particular relevance to this webinar and this topic are the SDG goals 3, which are good health and well-being, and number 13, which are climate action. So all nations are expected to take ownership and establish national frameworks for the achievement of these 17 goals and to follow up and review the progress that they've made. The implementation relies on countries' policies, plans and programs at home to help achieve those global goals. So this makes the SDGs a vehicle for civil society actors to hold governments accountable for implementation. But all stakeholders, including governments, civil society, the private sector, are expected to contribute to the realisation of the SDGs. However, action to meet the goals is not advancing at the speed or scale required. So civil society leaders and organisations are calling for activism to help accelerate progress and to urge world leaders to redouble efforts to reach the people who are being left furthest behind, to support local action, strengthen systems and institutions, unlock financing for sustainable development. So priorities for the remaining decade include the need to tackle growing poverty, empower women and girls, and to address what is now clearly a climate emergency. So I urge all nurses and midwives to advocate to their respective governments and institutions in their own countries to be committing to programs and initiatives that will help accelerate achievement of the SDGs. Next slide, please. I'm going to talk a little bit now about what we've sought to do at a national level in Australia to support our country in meeting its obligations under the Paris Agreement and the Sustainable Development Goals. So we have led the development of a policy framework to guide governments as they move forward on tackling climate change and health at a local, state and a federal level. So we began this work by consulting with the sector and with experts. We first developed a discussion paper proposing a national strategy, and we sought input from health and medical organisations across Australia and experts asking about their priorities and concerns in relation to the health impacts of climate change and what they wanted to see in a national public policy response. We distributed that discussion paper along with an online survey, and over a period of about 18 months we conducted several public forums in different states and cities. We held a virtual conference for 9 days, which allowed people to come in to ask questions, discuss ideas, and to make suggestions. As part of that work, we brought around 40 health leaders to present the results of the consultation to parliamentarians in the national capital. The insights from this consultation informed the development of what we're calling the Framework for a National Strategy on Climate Health and Wellbeing, which we launched at our National Parliament House in Canberra. Next slide, please. So the framework comes in 3 parts. The initial section outlines why we need a national strategy on climate health and wellbeing for Australia. So looking at the underpinning health, climate and economic imperatives for action. The middle section contains the policy framework itself, so that details the vision, the principles and the areas of policy action that are needed to achieve the desired outcomes for the strategy. The third section outlines a process for implementing the strategy. So we detailed the governance arrangements and mechanisms that might be implemented for evaluation and monitoring and reporting on the strategy's progress. Next slide, please. So the framework outlines policy directions that could be taken at federal, state or local level to protect population health from the impacts of climate change and support Australia in meeting its international obligations in relation to the Paris Agreement. So under each of the 7 areas of policy action, there's a desired outcome. So where do we want to head in terms of the policy direction? And we have specific policy recommendations to help achieve that outcome. Policy recommendations are focused on the areas which represent opportunities to capture health benefits for climate action, improve resilience and health outcomes for Australian communities. So the 7 areas of policy action include health promoting and emissions reducing policies, emergency and disaster preparedness, supporting healthy and resilient communities, education and capacity building, leadership and governance, a sustainable and climate resilient healthcare sector, and research and data to underpin decision making. So the framework that we developed has attracted a lot of interest internationally. It's been featured as a case study in Lancet Countdown and described as a key example of positive collaboration from health sector organisations that goes beyond aspirational policy directives and provides tangible strategies with measurable outcomes. So the framework recognises climate change is not solely an environmental issue, but the climate change represents a health and human rights problem with complex challenges, but also highlights that tackling climate change offers opportunities for economic and societal and health improvements. It also acknowledges that health and well-being is directly influenced by determinants outside the health sector, and therefore policy directions in the framework include recommendations for policy in the portfolios of energy, transport, infrastructure, climate and environment. So we encourage other advocates to draw on this work to advocate for policy on climate change and health in your own nations. Next slide, please. We've been successful in securing a commitment to the development and implementation of a national strategy on climate change and health based on our framework from the major opposition party, which is our alternative government, the Australian Labor Party. They made this commitment when the framework was released, and they've since written it into their major policy platform and reiterated it publicly on several occasions, including this year. We are yet to get a commitment from the current federal government, although we continue to work towards this outcome. Next slide, please. So while we originally targeted our advocacy for the national strategy on the federal government, we're pleased to report there's been a range of responses around the country from other stakeholders and policymakers in different states and territories. So the minor party, the Greens, have also declared their support for the framework and for a national strategy. The state of Queensland commissioned us to develop a climate health and wellbeing adaptation plan for that state. The state of Tasmania, the little island to the south, has begun a policy development process, and they're drawing on our national framework, as well as the Queensland plan to guide their work. The West Australian government, on the left of the slide, the large red state, has announced a climate health inquiry, and they've indicated that they will develop a climate and health plan for the state, which we anticipate will draw on both the national framework that we developed and the Queensland adaptation plan. And the Australian Medical Association is now also calling for a national strategy, as are many major health sector groups. The AMA has also declared a climate health emergency, which has led to a spate of similar declarations from medical organisations and attracted a lot of attention and increased interest in this issue. Next slide, please. So while there's a lot of increasing acknowledgement of the issue, and that's important and welcome, if it doesn't translate into action, much more is needed. So some of the things that we plan to do to keep this issue on the agenda in Australia is that working locally, we're providing training and support for health professionals to speak out on climate change. We're encouraging people to support other initiatives, encouraging health professionals to participate in other initiatives like the School Strike for Climate, and supporting young people in their advocacy. And we're supporting organisations to make climate emergency declarations and help to shape the pathways forward. Nationally, we're working with state and territory parliamentarians to develop and implement policy. So soon we hope to see the Council of Australian Governments, which is all the state and territory governments and the federal government, meeting together to table our framework for discussion and for there to be advocacy from the states and territories to adopt that framework nationally. We're working with independents and the opposition and minor parties in the national parliament to promote a climate policy agenda and informing and helping to influence other policy directives. We're continuing to encourage the federal government to show leadership on this issue and offer pathways forward. And globally, we work together with the Global Climate and Health Alliance to advocate for a higher level of ambition in the nationally determined commitments that our nations are putting forward to implement the Paris Agreement. Next slide, please. So that's my little overview on policy frameworks at the global level and some of the work that we're doing here in Australia. So thanks very much, everyone, for listening. Thanks for your interest in the issue, and I wish everyone the best as you move forward with your plans on how you contribute to climate action to protect health. I hope this has been useful. Thank you very much.
Hi, good afternoon, everyone. This is Katie Huffing. So excited to see all of you here with us today. And thank you to Sigma Theta Tau for working with us on this series. We're really excited to have these 3 webinars reaching a global nursing audience. And thank you to Barb and Fiona for your great presentations. So I'll be rounding out today's webinar with a review of nursing resources for climate action. Next slide, please. First, I'd like to introduce you to our organization, the Alliance of Nurses for Healthy Environments, or we like to call it ANHE. We are the only nursing organization here in the US who focuses solely on the intersection of health and the environment. We work with nurses and nursing organizations around the world on issues such as climate change, clean air, clean water, and healthcare sustainability. We are free to join and are a warm and welcoming group of nurses. If you're interested in expanding your engagement on climate change or other environmental health issues, please join us. And this photo here has members of various national nursing organizations coming together to discuss how we can work collectively on climate change. Next slide, please. As you've heard from the previous speakers, climate change is the biggest public health threat we currently face, but it's also the biggest opportunity. When we address climate change, we can have an amazing positive impact on the health globally and the health of future generations. And as nurses, we're perfectly poised to help lead the change in addressing climate change. As the largest portion of the healthcare workforce and the most trusted profession, our voices and actions matter. As you know, nurses are solutions people and we know how to get things done. There are solutions to climate change, but we need all hands on deck. In the following slides, I'm going to review resources and opportunities for nurses to engage on these issues. Next slide. There's a growing consensus that health professionals have a moral and ethical responsibility to learn about the health impacts of climate change, educate other health professionals, their patients, and their policymakers on these impacts, and to advocate for climate solutions. The health organizations shown here are just some that we work with who have made a commitment to climate action and are working collectively to engage their members on climate change. And as you can see, this is a really diverse group of health organizations, which is fabulous. Next slide. So where are nurses in all this work? ANHE has partnered with our board member, Dr. Elizabeth Schenk, to develop the Climate Health and Nursing Tool, or CHANT, to assess nurses' knowledge of climate change. We're exploring what motivates them to act on climate both personally and professionally and what actions they're taking. We'll be evaluating how these responses change over time. The 2020 survey is now open, and it's open to all health professionals though our main focus is still on nurses. I encourage all of you listening today to take a few minutes and take the survey. It just takes about 10 minutes, and please share with your other health colleagues. Next slide, please. As we move forward, it would be great to have a more diverse group of respondents with different backgrounds, length of time as nurses, and differences in education to see if your responses are any different. Some of our preliminary results show that there's a high level of awareness of climate change causes and health impacts. However, the nurses that responded were less aware of the contribution to climate change by the healthcare industry. We know that approximately 10% of greenhouse gas emissions here in the US come from healthcare. They're already seeing climate impacts in their communities and are making the connection that these climate impacts are affecting the health of their patients, such as increases they're seeing in respiratory issues and in mental health issues. Next slide. We've also found that most nurses see an opportunity to reduce greenhouse gases through changes to their nursing practice. However, it's a minority that believe we'll be able to adequately address climate change in time. The responses we received on nurses' motivation for action, I think, is really helpful as nursing organizations and individual nurses are looking at how we can engage our nursing colleagues. Not surprisingly, nurses feel motivated to address climate change because they see the significant health and environmental impacts we're facing. However, they can feel demotivated by not knowing what to do and feeling overwhelmed. Next slide. And hopefully some of these resources that I'll be offering for you today and will be highlighting over this webinar series will help make all of you on this webinar feel less overwhelmed and feel like you have the tools you need to take action. This U.S. call to action was launched in 2019 and has approximately 70 health organizations from the U.S. signed on. It's based on a global call to action that was released in 2018 and has over 100 organizations representing 6 million health professionals in over 125 countries signing on. These calls to action can help guide nurses who are unsure what we should be doing to address climate change. These documents identify climate change as a health emergency and provide discrete activities that we can encourage our governmental agencies and policymakers to take to address climate change. Next slide. Through our partnership with EcoAmerica, a non-governmental agency which has provided resources to support nursing engagement on climate and health, we've, over the past few years, been able to elevate the voice of nurses around climate change and provide visible leadership on this vital health issue. Next slide. Through their Climate for Health program, EcoAmerica brings together a diverse group of health voices to work together to address climate change. It's been so great to have the nursing voice well represented in their activities and has helped raise awareness among the health community of the great work already being accomplished by nurses to address climate change and health. Next slide. Climate for Health has also been providing support to help increase nurse engagement and provide opportunities for nurses. They recently launched the Climate for Health Ambassadors Program that provides health professionals with the knowledge and tools they need to speak and act confidently on climate change solutions. They also just recently launched their new Moving Forward Guide, which on the cover has a photo of myself and a group of ANHE nurses at the Global Climate Strike in Washington, D.C. this September. This free guide helps identify actions and provides guidance on talking about climate change, something that can be challenging for nurses depending on their local political climate. Next slide. We were thrilled to have Sigma Theta Tau join as a member of our nursing collaborative on climate change and health. The idea for the collaborative came from a roundtable we co-hosted with the Obama White House on nursing, climate change, and health. We had representatives from around 16 national nursing organizations at the meeting. They identified having a way to work on climate change in a collective fashion as one of our greatest needs. From this, the Nursing Collaborative on Climate and Health was born. The goals of this collaborative effort are to, 1, elevate climate change as a visible health priority, to create a climate literate nursing community, engage all stakeholders. Collaborative members commit to connect climate and health to engage communities, patients, colleagues, and other health professionals, policymakers, and the public. And finally, building collective support and action for solutions. We bring together a nationwide network of nursing organizations who will engage their peers, communities, healthcare institutions, the public, and policymakers in climate action that protects and promotes health. If any of you belong to other organizations that you think would like to join, please reach out to me and we can send them information. We are looking to expand to a global nursing audience. It's free to join and we provide lots of support for collaborative members. Next slide, please. The Nurses Climate Challenge is a national campaign to mobilize nurses to educate 50,000 health professionals on the impacts of climate change and health. This program is a joint offering by my organization, ANHE, and the organization Healthcare Without Harm. Nurses who register to be Nurse Climate Champions receive access to a free comprehensive set of easy-to-use resources that make educating their colleagues on climate and health simple. It's amazing. We now, after only being launched for about a year and a half, have over 13,000 nurses educated on climate and health. We are now looking to expand the initiative globally. Next slide. We have tons of free resources on our website, such as our free e-textbook, Environmental Health and Nursing. It has a whole unit dedicated to climate change. We have a robust toolkit of resources for engagement at our Climate and Health Toolkit website. Our report on climate change, health, and nursing, a call to action, includes not just a review of the science, but also tips on how to talk with policymakers about climate change and health, and how to write a letter to the editor or an op-ed in your local newspaper. The Lancet Countdown is a really great resource, and it's now released annually and provides the latest evidence on health impacts of climate change, as well as recommendations for actions. Next slide, please. In partnership with Climate for Health, the Nursing Collaborative has developed a number of resources that are available on our website. If you're looking for some inspiration, I highly recommend watching the Nurses Caring for Climate video. None of us should feel alone in this work, and this video highlights the amazing supportive community of nurses working on climate change who would like you to join them in climate action. Next slide. And here I'm giving you a sneak peek of a project that we're just starting to get off the ground. We're partnering with Project Drawdown, a leading evidence-based source for climate solutions, on what the top things nurses can do to address climate change and have the most impact. We are highlighting actions that we think will resonate with nurses and are inviting nurses all around the globe to participate. You should be able to sign up on this website, nursesdrawdown.org, by the end of the week. Even if we get only 5% of nurses worldwide engaging, we'll have 5 million nurses taking collective action. Imagine how amazing that would be. I hope that all of you will join us, and we'll be sending out updates if you sign up on the website. Thanks so much for joining us here today.
Thank you so much to our presenters today for all of this great information. We'll take some question and answers from our audience now. The first questions have already started to come in, and for attendees that are on the line, please submit your questions via the GoToWebinar text box or via the chat function on GoToWebinar. The first question is the CHANT survey published somewhere?
So we've had our preliminary analysis published in the Annals of Nursing Research just recently. We haven't published the full results yet, but please start utilizing the survey so that we are able to start publishing this, because I think just from our initial findings, it's very interesting, and I think something that's really going to help drive nursing engagement on climate change.
We have several questions coming in about the slides being available. The presentation and the recorded webinar will be available via the Sigma repository within 10 business days. You will receive information on how to link to that via email. If you don't find it, though, you can go directly to the Sigma repository within 10 business days, and it should be there. Is the ANHE part of the collaborative? Katie, I believe that question is for you.
They are not currently part of the collaborative, but we're in talks. And if any of you are members of the ANHE, I would recommend sending a message asking them to become part of the collaborative, because we would love to have them join us.
We would ask that any attendees would please submit via the questions or chat function what country that you are currently residing in or representing. Are there any thoughts from the group about how climate change has affected coronavirus spread?
I haven't heard anything. This is Katie. Have Fiona or Barb, have you heard if there's any links around climate change to the coronavirus?
It's Fiona here. I don't feel qualified to comment on that, I'm afraid. I'm not aware of any immediate associations that are being drawn other than changing environmental conditions.
Yeah, I'm of the same mind. I haven't heard anybody making those connections.
The next question that's come in, what can we do to convince our reluctant leaders who deny that climate change is real?
Vote them out would be the very first thing. This is Barbara that I would suggest. we work on, and many nurses are in fact involved, particularly nurses who are in unions, work through their collective activities that way. And then also meeting with those who do not agree with us, and using your identity as a nurse to bring the science in your caring, and not be afraid to talk with them about what we're thinking and that it's evidence-based. I think it's really important.
Could anyone comment on climate and health professions education?
Barb, you might want to start with that one.
Yes. So if you go to the EnviroN website that is on the screen right now, there is, in the e-text, there are curriculum materials that have been created on climate change, and that can be integrated into pre-licensure nursing education. There are also materials that can be used for nurses who are currently working, and the Climate Health Challenge, the Nursing Challenge Kit, has got information including slide decks and all kinds of tools that can be used. You could use them in nursing rounds at hospitals. You could have them as part of your nursing subspecialty organizations meetings. There are various ways and tools. Nobody has to create new tools for educating nurses, whether that's in their pre-licensure education or in professional development at this point.
How can we get hospitals more climate change friendly?
Fiona, do you want to take that one?
Yeah, sure. Thanks, Barb. There's a lot going on to improve environmental sustainability and climate resilience in hospitals around the world. I think a lot of those initiatives are beginning as voluntary initiatives in the absence of guiding government policy. But one initiative that's taking off around the world and is really supporting a lot of hospitals and health services to make progress on this is the Global Green and Healthy Hospitals Network, which is a project which was launched, Healthcare Without Harm. That network now includes members that represent over 40,000 hospitals and health services globally. So it's built around what's called the Global Green and Healthy Hospitals Agenda, which is 10 areas for action that members sign up to working on in joining the network. The network is free to join, but members have to commit to working on 2 of the 10 goals, which are leadership, energy, waste, water, buildings, transport, food, chemicals, pharmaceuticals, and procurement. So there's lots of ways in which people can take action and are taking action on this. And the Green and Healthy Hospitals Network also collects case studies from those participating members. So there's a wealth of information emerging from that network about the strategies and initiatives and programs that can be implemented by hospitals and health services. So that's available at greenhospitals.net.
I also wanted to plug for the next webinar happening in 2 weeks. One of the nurse presenters will be talking about healthcare sustainability. So I think you might be able to get some more in-depth information then.
Right, and on the Healthcare Without Harm website, they have a distinct section with resources for hospitals with regard to climate change mitigation. So, and while they did sort of birth the Green and Global Healthy Hospitals, they have also some distinct resources on their site. So you may want to look there also.
Is population control part of any of these interventions? What about efforts to control consumption? Most of the interventions suggested seem to be things nurses do already, like advocating and caring for vulnerable populations.
Katie, do you want to talk about the drawdown
Sure.
population?
Yeah, so as part of that new project that we'll be launching soon, one of the areas that we're focusing on is on gender equity, on educating girls and access to family planning. Both of those go hand in hand, and it's true, don't have the resources to have this, exponentially growing population. It also, having access to family planning also helps women and families have children that they can afford and when they want to have children. So we consider it a win-win, focusing on those areas. And there's, really significant climate factors that especially with educating girls, that's one of the greatest factors for families that go through an extreme weather event, whether they are able to adapt or not. Having a woman head of household who has secondary education allows that family to have more resources and more ability to come out of those extreme weather events in a positive manner. So there's lots of different climate actions around gender equity. And so stay tuned for our Nurses Drawdown to get more information on how nurses can engage around that issue.
Are you aware of any tools that healthcare organizations, practices, or individuals can utilize to self-assess their climate impact?
There is an assessment tool on the Healthcare Without Harm climate change on the pages that focus on climate change. There is.
Yeah, and that tool has just been updated and can link health impacts related to energy usage and greenhouse gas emissions. So it's really powerful. There's also a number of tools online. If you Google, my energy use and greenhouse gas emissions or my climate impacts, things like that. There's a number of tools where you can put in, the type of energy you use, what types of foods you eat, your transportation, all of these things, and it can calculate approximately your climate impacts individually.
How can we support young people who are increasingly stressed by the climate change statistics that they hear about?
I'll take a stab at that. This is Barbara. We just recently had a meeting of nurse practitioners that are in Northern California, where we've had the fires over the last couple of years, and it has been really devastating to youth, and they are feeling anxious. They're feeling like their lives are unpredictable. Some of them suffering depression. Some of them lost their homes. So in our most directly impacted communities, I think that we really need to increase our mental health support services, and we need that everywhere. But another thing that we also discussed as nurses is that this is affecting us as well. And there's a whole new trajectory of thinking about what is being termed eco-grief. And there are other terms that are emerging. But I think that this is an area where nurses need to both be paying attention and also developing tools to protect ourselves, and ones in which we can implement programs in the communities. So you're absolutely right, whoever asked that question. Our youth in particular are to be protected here, but they also are taking action. And one of the very, very good cures to this problem is getting involved in building community with other young people and taking action. And we're seeing really enormous changes in the youth that are engaging right now.
It's Fiona here. I just wanted to add to that. We have a group here in Australia of psychologists called Psychology for a Safe Climate, who are developing a lot of resources to help people deal with eco-anxiety and climate grief. So I'd encourage people to Google them, Psychology for a Safe Climate, because there's lots of resources there on how to manage anxiety, how to talk to others about it, and how to support both yourself and others.
And this is Katie. There's also on our website, on the Nursing Collaborative section, where we've got resources that have been developed by Climate for Health. They also have a report on mental health and climate change and actions that's really fabulous. I'd also just realized that on my slide on the Nursing Collaborative, I left off one of our most awesome partners, the National Association of Hispanic Nurses. So I just wanted to do a shout out that they're part of the collaborative and have been members since the beginning.
We did have an attendee comment on getting the youth involved in the Sunrise movement, that it makes the kids that she works with feel empowered and hopeful.
Yes.
That's awesome. Yes. Yep. They make me feel empowered and hopeful too. I think it goes both ways.
That's all the time that we have today for the webinar. Thank you so much again to all of our presenters and for the attendees. Sigma is grateful that you took the time to share all of this wonderful information with our audience, and we look forward to hearing more from all of you in the future. We will be sending you an email shortly after this to retrieve your continuing nursing education credits if you would like to obtain those. Have a wonderful evening, everyone.
Thank you.
Thank you.